Hello, my name is Talia Hogue. I'm a student at North Central University, and today I'm going to be talking about issues that you want to take into consideration when looking at diagnosing, assessing, and treating a patient. I should say, rather, assessing, diagnosing, and then treating a patient. I apologize, I have a cold. So, the first thing I wanted to talk about after doing the readings this week was how it seems to me that the system that is set up in the AAFM, American Association for Marriage and Family Therapists, the board that's responsible for looking at particular accusations, is very, as was stated by J.C. Corey and co., that it's very punitive instead of rehabilitative. When looking at an example, there was a woman who allowed her client's son to come to her house and clean her garage for a small fee. How she got her license revoked for that. Given that my background is in social work, that wouldn't have been necessarily inappropriate depending upon the organization that I was working with. It's on the border, but I wouldn't have lost my license as a social worker had I allowed a client's son come to my house and, rake the leaves or shovel the snow. So instead of having an active conversation with this particular marriage and family therapist, they revoked her license and she had to spend all this money and all this time to justify why she still should be considered or be able to practice marriage and family therapy. One of the other components that I think is not necessarily helpful is how long it takes for the board to make a decision. If they come down on the side where they actually are in favor of the therapists, the length of how long that tends to take impacts their credibility, both within the field and also within the community at large. There was also in this paper I read, there was a marriage and family therapist who her family at the beginning began to be really supportive. It looks like she might have done billing incorrectly, not that she was trying to take money from clients, she just made a mistake. And her family in the beginning said, "Oh, we got your back, it's no big deal," but because it took so long and they're not in the field, they began to wonder whether or not there was more than what this young woman was communicating or disclosing to her family. So she lost credibility, not only in the community, within the field, our field, but also within her family. So to decrease the amount of time it takes to find a way to be more efficient would be not only in the interest of the therapist, but also the best interest, I think, of the person or the people or the parties that are, making the accusations. Pardon me. One of the things that I noticed, and I agree with what this was also in this article, is that MFT programs should be more diligent in providing real life examples. I really appreciate having an opportunity to read this article. There's examples that I would have never known or been able to glean from, the little bit of data, the little bit of language that's used within the code of conduct. That would have, I don't necessarily think I would have allowed a client's child to come over and do something on my private property. But I could see saying, okay, how about if they come by and shovel the path in front of the office? I'll pay them $5. Because for me, I like to keep my personal life and my professional life very separate. So I wouldn't ever want to tell a client where I lived. But I wouldn't have even crossed my mind that that was an ethical issue, that I couldn't pay a kid $5 because they were my client's son to shovel the yard or shovel the pathway. So MFT programs, I think, I agree, need to be more diligent in bringing real life examples to these courses to help students understand the potential issues that they could find themselves having to deal with. one of the ideas I had was maybe have the teachers within that institution, like North Central University, all kind of provide real life examples and then have someone create a document that is given to students during this course. And for 1 week, they have to write a discussion about it, looking at the application of these code of ethics in the real life. And open up, a dialogue between teacher and student to make sure that everybody's on the same page. I don't want to go into too much detail of my past, but I studying acupuncture, I was involved in a malpractice insurance as a student, or a malpractice case as a student. It scared the stewbeans out of me, and I ended up having to find legal representation independent of the school's insurance for students, and it was a nightmare. It was an absolute nightmare, and so I think I might be a little hypersensitive than your average student because of that professional experience in my past. It would be important I think, thus far, I haven't gotten any documentation or training on how to prepare myself as a licensed marriage and family therapist for dealing with any potential issues that may arise with the ethics board. That component added to this class would be really helpful. I also think that it'd be really important for the teachers to continue to stress how vital it is for MFTs, LMFTs to have decent and appropriate supervision, either in private practice or when working for an organization. In other words, you don't want to work in an organization where your supervision is mediocre. You could be putting yourself in harm's way by not making sure that your supervisor is going to make sure that you have everything you need and is appropriately managing you and guiding you when dealing with ambiguous issues that may arise when treating clients. It comes up, so you want to make sure you have a rock star supervisor. Again, either in private practice or working for an organization. The three code of ethics that I wanted to kind of talk about, that I personally will focus on, I plan to do research on as a student and then be mindful of when in practice, is multiple relationships. Again, back to that paying a kid to shovel the yard or shovel the pathway. Because that's something I see that I could have done, I definitely need to spend time understanding this particular preamble, this particular ethics issue, so that I can have I don't make any innocent mistakes. Don't have sex with your client, the stuff that's in black and white that's super easy to understand, that everyone, regardless of their training, would know is inappropriate. That's not what I'm talking about. It's the subtleties. I was invited to a bat mitzvah because my client is coming of age, and how do I politely say that would be inappropriate for me to go? Or would it be inappropriate for me to go? I think it would be. So where's the training around how to say thank you but no thank you? So the little things I think would be very helpful. But how I plan to be more mindful, again, is to get the supervision and the training I need to be able to ascertain that appropriately. The other one is electronic therapy. I think that the first thing I need to do is take a course on both effective treatment and diagnosis and assessment. I wouldn't reverse, but there are way too many issues that I could see could happen where you're not assessing appropriately because you don't have all the nonverbal communication, because it's via computer, or it's even on the phone where you're not being able to see people's facial expression. So making sure that you have recommended assessment tools for e-based communication, and how to diagnose with those particular tools, and then how to come up with the appropriate treatment plan. Right now, I know I don't have that skill set. So what I plan to do is find an additional course to take. And lastly, gifts. Again, my background's in social work. So the organizations that I've worked in, it's been appropriate for clients to give me a gift as long as it was less than $25. So over the holidays, I've gotten oranges, or I've gotten socks, or I've gotten a gift certificate to the movies. And because it was always in the employee handbook underneath $10 or underneath $20, whatever have you, I always graciously accept. If it was more than that, I'd have to explain why it would be inappropriate. So, as therapists, is it inappropriate for me to give a client a congratulatory card for graduating high school, or having a bar bat mitzvah, or a I am so happy now that you guys have been able to successfully be impregnated and your first child's being born, and I know this was an issue for you and that's why you came into therapy, and here you are now with life growing inside of you and your baby was born healthy. Here is a card. How do I plan how to come from a most ethical place with regards to gifts? Good supervision. I'm going to heavily rely on people that have been in the field that are what I consider expertise to guide me as I'm learning how to be a marriage and family therapist. And then again, even when I think I may be an expert, I still will heavily rely on those that have more experience than I do, so that I don't fall into making, as I said earlier, innocent mistakes. Thank you for your time. As always, I will post at the bottom of this YouTube page the one particular article that I heavily relied on when thinking about how to be an ethical person with regards to assessment, diagnosis, and treatment.